we've got some good stuff for you today. We're going to look at not necessarily the cost, but what generates the cost for a case, and what determines the cost for somebody to have their mouth restored. If we were to take a look at, kind of and sorry for the granular image here, but if you'll notice let's take a look at this is a perfect smile, right? It's somebody that's got perfect teeth, no restorations, no crowns, no fillings, nothing. Teeth are absolutely perfect, no periodontal disease, gum tissue's perfect, it's not red, it's not inflamed. The mouth is in a very neutral, healthy state, right? So, and that's the ideal. And that's when people, when you meet somebody and you see, if you were to see this person and their smile, you think, wow, what a beautiful person, what a beautiful smile, right? So, and that's what people want. And that's what we as dentists and surgeons try to accomplish is this sort of an ideal. However, when that's the ideal, but we are faced with something like this, now we're on the polar opposite extreme, and we have to, take a patient who's in this sort of situation where it's the complete opposite. The pH or the neutrality of the mouth is not neutral. It's very acidic. There's inflammation, periodontal disease, bone loss. And so, so our goal is to take, somebody who's got this situation here and restore them to, would be an ideal. However, this is a prosthesis. It's not his teeth. So, we removed all of these teeth, extracted them, grafted the ridge, filled, because for example, when I pull this front tooth out or all these teeth out, I'm left with, holes everywhere. So I have to smooth the ridge off, not much. A lot of people will take off, 10 millimeters or so for creating space for the teeth or the prosthetic. I don't do that. I actually try to maintain the integrity of the alveolus, which is the bone where the teeth are housed. And because when we pull these teeth out, there's a lot of granulation tissue and infection. In fact, we can take a look at video here. So this was a case and I think I've probably shown this before, but here's his pre-op before photo. And you see this large, what's called a granuloma. So this is just because it had been sitting there for so long, the body's, it's actually quite simple. When there's a foreign object or the body recognizes something that's foreign, it creates and I talked about this last week, it creates a well of infection or trying to excrete or eliminate that what would be foreign body away from the body. So, and that's where infection germinates or stimulates from, is something that is now foreign to the body, and the body's way of rejecting it is to create a well of infection. And that area is very acidic, and that's what causes the damage, the breakdown of tissue, the breakdown of the bone. And ultimately, it's actually, I think it's pretty remarkable that we're made in this way, in the sense of, the acidity increases around as the debris attaches to the tooth, and the acidity increases. Now all of a sudden that tooth becomes the foreign object, and the body starts to reject it. And so, in a case like this where the patient has so much debris built up in very acidic environment, these teeth they're gonna have to come out here pretty soon. So when I pull the teeth out and clean up, so I'll pull out the tooth, clean up inside where the bone is, and of course we raise a flap and do all that, in the process. So we can look at some video here of some of that process, maybe because of my horrible technical skills. So this is actually some surgical video. So we're removing the tooth, and you'll notice the gum tissue architecture is it's not even. So the one that I had just pulled, the tissue's up here, and the one I'm pulling now it's down here. So we've got to somehow align or create an architecture that's more even. So, and that's why I say I don't do what's called an alveoloplasty, where I cut that bone all the way, because I'd have to go to the tip of the tooth that was the highest in order to cut down enough. And that's a destruction of a lot of bone. So you don't want to do that. I want to try to maintain the integrity of the ridge as much as possible. So I'll pull the teeth out, make an incision, raise a flap, and go in there and clean out each of those holes really, really good. And I know it's kind of graphic, but and that's what I'm doing here. So I'm elevating the flap, pulling the tissue back, and just really degranulating and cleaning out each of the sites. And I haven't actually removed any bone yet. I've probably done, with what we call a rongeers, I've probably done a slight contouring or smoothing, but I have not removed any. I want to try to build that bone up and create as substantial a ridge as I possibly can. And you'll notice I'm just filling those, cleaned out the holes, and filled them with graft material, which we harvest some from the patient, some from, or for donor bone. And then I put the graft material in the socket, and then I put a membrane over the top, and then I sutured everything closed. So that allows me to create an environment. One, I've removed all the acidity or the teeth that are bad. So I've changed the pH immediately. I've changed the pH of the environment, and then was able to clean it up and then graft. So here I'm actually doing what's called an immediate placement. So I pulled the teeth out, which we do a lot of times. We'll take the teeth out, place implants immediately, and in this case, I'm able to do that because the lower bone is more dense than the upper, and so that's how I'm able to place implants immediately at the time of extraction. So, and all of these implants had high torque values. So, and this is an edited video, so you don't really see how I was able to torque them in. But long story short, this is a process that, there's no way that I can put every patient in the same category and say, oh, we're going to do one thing to every person. It's like building, one house and everybody gets the same house, Yeah. And, the versus, and liken that to building a house, the foundation is key, right? We have to build a foundation that is stable, that is sound, that the house is going to stand, the time of, and the elements and everything like that. So if the house is on a hill, we got to plan for that, right? We got to build one can support the structure and recognize that there's possibility of the land moving or sliding down, like we talked about a few live streams ago. And so if we don't plan for those things, then we can end up with, with a much challenged situation. And again, that's where I feel that utilizing just 4 implants to support everything for every single case is not necessarily the best scenario. So, all right, let's see. So that was on his surgical date, and remember, let's go back to, so this is his before. That's before, and then you saw some of the video of removing the teeth, grafting, implants placed. Now his case is all done, and here's his after. So, absolute transformation to go from where he started to this. It's amazing, and it's we see so many cases and patients that come through and go through the process. And when they reach this stage, they're very grateful. They recognize the change. Now, he had been out of work for over a year. Now he can go back to work, and he can do his get back on with his life. So, and I kind of get it, because when they are in, let's see here, when they're in a state like this, they don't have a lot of confidence. It's, and again, kind of how we talked about last time, or actually 2 live streams ago. When I look at this, I see complete just giving up, right? Like, yeah. He's completely just kind of given up on his mouth. I wouldn't say on life, but I mean, certainly with his teeth in his mouth. He's like, what's the point? What's the point of brushing? What's the point of even trying to maintain this when in his mind he knew that it was a pretty hopeless situation. So versus today where he is, here's a close-up shot, but he's more hopeful, right? Like all that problem is now behind him. It's solved. He can go on with his life and feel confident in what he has and the investment that he's made.
Yeah.
And this is a great case because he will, so I'll keep that up there actually. He will, when I saw him a few days ago, I mean, complete change in his hygiene patterns, right? Like I could tell he was really taking the time to maintain this because he's now made an investment in his mouth and himself. And he's really taking that extra time to maintain his investment because he doesn't want to lose this. Because if he continues with those same patterns and habits, he will possibly lose the implants as well. It's certainly a possibility. It's not, implants are not, I'll have patients that will say, I want implants because I don't want to deal with periodontal disease or cavities or whatever. And it's like, well, you still got to maintain your teeth. It doesn't mean you can just go on without maintenance. So, all right, let's see here. So that's, kind of what I wanted to show there. And let's look at some video of so this is the prosthetic in the mouth. And it's, looks great, but certainly is a prosthesis. This gum tissue here it's not real. This is ceramic or zirconia porcelain. And so maintaining and creating architecture is one thing that I kind of talk about a little bit. Again, if we go back to this photo here, perfect soft tissue architecture, hard tissue architecture, the teeth are in perfect condition. And so, let's say we had a case where we weren't taking all the teeth out and we were trying to recreate that hard and soft tissue appearance. That can be challenging, but it's certainly not impossible. Here's a picture of someone, they tried to do that, but you can see that they've compromised the architecture and it's not even anymore. And it's not a great photo, but as you retract everything back, you can see that there was not a whole lot of regard for the soft tissue, hard tissue architecture and the contours of the teeth. The contours are off. At the gum line, you see everything kind of looks off. And so
kind of looks fake.
It looks fake, right?
Yeah.
I mean, it looks like chiclets. So you got to, and that all is dictated by the doctor who's doing the case. And so it's really important to consider all of these factors when redeveloping, redesigning, and creating somebody's mouth. And so, and it goes back to that initial phase and the planning, just like the scenario and the analogy of creating and developing and building a home or a building. I mean, it starts at the foundation and then you build from there. So.
Well, it makes me think of when we were younger, all four of us, my four siblings, we all went and got braces.
Yeah.
But our treatments were all completely different. The end goal was to straighten our teeth, right? But I think my oldest sister, they put like something that kind of like brought her jaw forward or something. I don't even know what it was, but I never got to use that. So it's kind of the same here, right? Like just to get your teeth straight and the bite till fully close all the way when getting braces, you have to go through all this, and it's different for everyone. Like I'm saying, it was different for me than it was for my sister.
Right.
The same thing applies here with dental implants. It's not a one size fits all for everyone, right? Some people are going to need 6 implants. And like you mentioned at the beginning, is you have to first plan for it. We get so many people calling and they want to know an exact price and exact treatment for their case, and I mean, we can kind of give them a ballpark, but we really want them to come in or have a consultation with you so you can plan that, so you can create the blueprint, so you can know how the foundation looks to see what the next steps are going to be or how long the process is going to take and all those.
Right. Yeah, I mean, and that's, it's really important that the plan and the treatment is tailored and custom tailored for each patient. For example, this case here is very different than the case I just showed. This is a situation where, over the years, the patient has lost teeth. Actually, the gum tissue is not as inflamed. It's not, it's the environment is not a very acidic environment. But this is a mechanical issue. It's a matter of they've lost their back teeth, and over the years, because of the mechanics and how the bite is, I've said it 1,000 times, but when the biomechanics are off, it's as damaging as when the bacteria and the acidity is high. So when you've got like periodontal disease, gum disease, plaque or tartar and plaque buildup, creates an acidic environment. It's very damaging to the tissues, bone, and teeth. But by the same token, the mechanics and the way that the mouth functions can be as damaging. She's going to lose her teeth as well, but it's not because she hasn't tried. She's brushed. She's tried to keep her teeth healthy, but because it doesn't function properly, it's breaking down and teeth are breaking off and snapping off here and there. And it's all about the mechanics, because there's so much load in when we bite down that if it's not evenly distributed, then ultimately it's going to break down. And that goes back to the building a solid foundation. Every case I have to determine the best number of implants according to the mechanics of the patient's mouth. So, like in this case, removing these teeth, determining most ideal implant placement, position, so that in the end, long term, and I haven't restored this case yet, so I haven't finished it, so I don't have the after photos, but I mean, you can see where, she certainly has to do something. All the implants are placed, but we haven't finished the prosthesis. So again, this is a mechanical issue. The other one I showed was a kind of a health issue, or just the acidity of the patient's mouth. And so both are very prevalent. The number of people that are walking around that are like this, you wouldn't even know actually a lot of times. But once these cases are done, it's a game changer for them, because now this is no longer an issue. And I do have my limitations. I'm certainly not going to take a patient from here, to a smile like this. I can aesthetically, but there will, like the pink tissue and the papilla in between the teeth, and that symmetry and that architecture, I have to use prosthetics. I can't regenerate tissue and make it look natural like this. So, and that's the ideal. Of course, we would want to do that, but it's just not possible. There's no one out there that can actually, grow the tissue that way. So, but just with the prosthetics, we get some really cool, beautiful looking aesthetics, and have cases that, are able to, the patient get back to normal life, get back to work, whatever the things that they had kind of set aside while their mouth was falling apart. So, and that kind of takes us into the concept of the cost. Here we try to keep the costs contained to but I can't put every patient into the box and charge the same on every single patient, because each person brings different challenges and things that we have to overcome, so that in the end I can achieve the most ideal results. And so let me go back here and let's see. So here he was, before we put the teeth in. Obviously implants are in, but teeth are out. And so to be able to go from there to here's, it's awesome. And you'll notice, like, it looks very natural. I go through a process in both This color, I think, is a little, I mean, it actually looks better than it does in the camera because of the flash and everything. It's not this bright. But the size, the shape, the fit, everything just kind of fits for the individual here. So they're not too big, they're not too bulky. The balance is there. So when he bites down the right side and the left side, it's totally evenly balanced, which is critically important for this type of a restoration. I mean, any restoration. Again, the mechanics are really important. So
when you say, because you always mention the mechanics or the biomechanics, that means that the bite is just evenly distributed
throughout the whole
just
arch,
throughout.
yeah. Because imagine if he was just hitting like on one side and the load was all being taken in that one spot. The prosthetics can break, these can break, or you can have implants fail because they get overloaded. And so it's critically important that everything is evenly distributed so that the load is distributed throughout the mouth and the arch rather than in one point, so.
Yeah. So is that why, because I've seen x-rays and I've seen, obviously working here, how all-on-fours are placed. And
they're angled.
All the load is pretty much here.
Yeah,
right?
exactly.
So that means it's tough for them to chew, because usually when I chew with my
on the
molars
back.
in the back,
Yeah,
right? Because I'm chewing steak, and you want to get as much strength
bite.
as you can. Yeah, as much bite. Now, I can't imagine trying to chew it with my front teeth. That would kind of, I don't know, I feel like it hurt.
Yeah, that's exactly right. In fact, with the all-on-4, they will eliminate certain teeth. Let me go here real quick. If we look at an all-on-4 scenario, here's one right here. And I've shown this picture before, but this is actually because all the load and all the force is in the front, it broke the prosthetic. And of course, this is what you would get at one of these corporate all-on-4 centers. It's a titanium bar with plastic teeth and plastic acrylic that's wrapped around the bar. But they will actually stop at like the first bicuspid or first premolar. Usually they don't even get back to the first molar, and it forces a patient to chew all in the front. So you're right. I don't know how it feels because I've never experienced it, but I would imagine it feels really weird, that you really can't get a good bite because you're not really chewing on the back teeth. And that's where, in this case, after I had rebuilt it, I added implants in the back so I could get the teeth in the back and have most of the force back there rather than all of it being concentrated in the front. So that's where I say, each case needs to be evaluated and treated according to the needs of that patient and not putting everybody in that all-on-4 box,
Mm-hmm.
And I've seen ads where they'll say, all-on-4 whole mouth, $30,000 or $45,000 or whatever the number is. And it's just not possible to do that. I would never put an ad out there for the price of a whole mouth, right? Because I cannot put every patient in that same scenario. So, and nor would I do it because I don't think it feels natural. I don't think it feels right.
Yeah, and then from all the feedback that we get from just patients says that it's just a clickbait to get you. And I mean, they say all these things, teeth in 24 hours.
What is a clickbait? What does that mean?
It means that they're showing you an ad that's creating like that's creating this awareness or this it's pretty much they're deceiving you to want that. Like, for example, a clickbait could be, all right, we do this for payments as low as $299 a month. And right, like if you have perfect credit and like you have like no debt and like all these things, you could be that person that could get the $299 a month with the lowest interest, but since that could be like the best case scenario, that's what they're marketing, right?
Right.
Same with like these
So
places.
it makes you click on the ad because like, oh wow, I could possibly, I
Yeah.
could do that. I need this, right?
But they don't say like not everyone. Like again, for example, when they're clickbaiting and they're saying teeth in 24 hours, probably about 20% of people or less will actually be able to be good candidates for teeth in 24 hours, and that's why they're promoting that. Like they
So
want
it's
you
not
to,
a lie. It's not like they're saying, something that's not true.
yeah.
Because even if out of 10 patients they're able to do it on one, they can put an ad out there that says teeth in 24 hours,
Yeah.
I guess.
And then just to get you in, when they knowing perfectly that like 1 out of 10 are the only ones, so that's why it's called a clickbait. They're baiting you to click on it and to be able to learn more or buy whatever. They
Right.
need you to buy, so.
Yeah, and that's unfortunately, it's gotten into the realm of what I've dedicated my entire life to, and that's reconstructing patients' mouths. And as when I was a resident, treatment planning was so like we would spend, on a case, well, especially in a university setting, it just takes forever. I mean, I had cases that I started when I was first year resident and finished my third year, 2 years to take a patient through the process. But when you're starting out, you have to, get everything signed off and checked off by the, whoever's over the operating room or the clinic at that time. But the treatment planning process, we would never at that time ever even consider the all-on-4. I look back on, and we talked about axial loading on implants. So that means the implant is vertical up and down, and the load is directly up and down. And put an implant at an angle like this and put a off-axis load on it, and then extend a cantilever of 10 or 12 or 15 millimeters off the back of that. In the infancy of implant prosthetics and implant surgery, we would never, ever, ever consider that. And I still don't think it's a great idea. There are cases and situations where you want to engage as much bone as possible in certain areas and avoid certain anatomical structures, but I feel you should be able to operate around those areas and treat them accordingly, place implants so they have a vertical load and not an off-axis load. But anyway, so the planning of each case was very specific for every single patient. There's no way that my peers would, and the faculty at where I trained would ever consider every patient getting the exact same thing. So, and I think we've shifted away from that ideal, and that's where it's kind of frustrating to me because, of course, now the media drives everything, and there's ads everywhere for teeth in a day, teeth in an hour, all on 4, and a certain price for the whole mouth reconstruction. And, every patient is so different. It's just not possible to have that be it's going to be the one size fits all type of solution for everybody out there that needs this type of work. And I've shown, just 2 or 3 cases here, and every single one, my approach is very different on every single one of those cases. And so I feel like it's important that people understand, and not to say that, you can't get the all-on-4, or there are certain cases where maybe it'll work. But, people need to understand that they need to do good research and gain information as they're going through this process. Because that's the other thing. There's a lot of people in these situations.
Yeah. When you mentioned that the media just kind of drives the market,
Yeah.
but also with all these corporate all-on-4 centers, like everyone knows that when a company it's growing, they're mainly doing it for profit, especially when they're so big. They stop caring about the patients or the customers' needs, and they're just trying to reach numbers for their investors. And so, yeah, that's why they're creating this, come in, we'll get you in 24 hours, we'll do it for this price. They promise the moon and the stars just to get you to come in, and then they probably do the bare minimum, which is, it's easier to place 4 implants.
Oh, yeah.
6, 8.
And I could be in and out in about I don't even know, 30 minutes?
Quick, right? So that's what they're trying to do.
Literally.
I mean, if that doesn't show, like if you go to a place and they're just cranking all these cases out so fast, they're not really focused on the needs of each patient, then that should tell you
Yeah.
what their intentions are.
Yeah, and if we have any viewers that have had or been in this sort of scenario or have had these experiences, comment and hit that subscribe and like button. But make comments about your experience in this process. I could be completely off. I don't know how these corporate companies operate. I've never been to them. I'm only speculating, and I shouldn't speculate. But I'm not speculating. I've heard it from my patients who have come from these scenarios and have spent a lot of time, money, and effort. And so I'm just kind of saying what I've heard from people that have been through the process and have had to have it redone, So, and that's not everybody. That's not every patient that goes through one of these corporate centers, because I see so many patients. I just see a few that have had a bad experience. And so that I'm probably biased because I'm only seeing the ones that have had a bad experience with it, so.
Yeah, I mean, and we do get the first-hand reviews from them, right?
Yeah.
Because they were there, they know what they felt like when they were there, they know what was offered. So I think it's pretty good feedback that we get from these patients, right?
Yeah. I mean, every single one of them has said they felt like they were at a used car dealer, and it was like they saw the doctor for, 10 minutes max, and then immediately they were in the finance department, so, and obviously even in my practice, the finances are a big part of it, but also the patient and the proper treatment for that patient for long-term results. Because again, whether the patient pays, $40,000 for a whole mouth or whatever the number is, for me, it's 5, 10, 20 years down the road, is that investment still paying off? So here you're gonna pay more here, without a doubt, than you will at one of these corporate centers. But it's not that much more, but you're going to get so much more in return. And that I do know, that the money that is spent will be a much greater investment long-term than just trying to do it fast and just using 4 implants and avoiding doing certain things so that you can get the case done quickly. Because that's the other part of it. It can be done, in a month or 3 months or in a day or 24 hours. Or you can take the proper time to let the bone heal, implants heal, tissue heal, make sure that you have a solid foundation that you're building on, and also have had planned out what that foundation is and looks like and where the implants should go, so that when you get to I'm just thinking of a case I'm working on right now, implants are like all over the place, and I don't have, because I didn't place them, and it limits the control that I have, so that, and it kind of affects, again, I'm managing through it, and it's going to be an amazing case. But because I didn't place these implants, I'm restricted. Had I placed them, I would have put them in exactly the right position. So I have 0 restrictions at the time when it comes to building the house, right, or building the teeth on the implants. And so, but that came with planning, and it's because there was no planning, and so the implants are all over the place. And now couple of guys have tried to restore the case and have not been successful. And so now we have a solution. It's going to turn out amazing, but we do have to do some workarounds in order to work around the placement of these implants. But when the implants were placed, they just wanted to get them in and be done with it quick, like put as many implants as they could without really designing and thinking about, okay, what's our long-term goal here? What's the prosthesis going to look like, and is this implant in the right position? So aesthetically, it'll be a good outcome for the patient. So anyways, again, very important from A to Z, that the A is as important as the Z. And so I, on every case, want to plan it out properly, make sure that we know where we're headed. And that way, as I'm moving through that process, it's a smooth, easy process. So, for example, this patient here, because I started him from the beginning, and you saw those surgical videos. So this is I took these photos, so I took him from here to here. It was really seamless and very streamlined. It took us about 9 months to finish the case, maybe a little more than that. I'd have to go back and check. But again, throughout the entire process, there was never a time where I had an implant that was not in the right position or dealing with a situation where I had to really compromise the end result. And it's, it's complex to go from this to this. It's a process, but because in my mind, and I showed some of those surgical videos of the extractions, even the extracting of the teeth is a big part of the process to get him to this point. And so that's where, from, like I say, from A to Z, every single step in that process is really important. So anyway, so it's, I feel like it's an important topic because there is a lot of venture capital money now in the implant world. And so the ads are out there like crazy. And patients need to be aware. And I feel like on this channel, we are creating an environment where patients can ask questions, or, people can be informed about kind of the ins and outs and the guts of a practice that's actually doing this on a daily basis, and what it takes in order to generate and to get results like this. So all right, so I think that'll probably do it for today. Again, hit that subscribe and that like button. Ask questions. If you have images or anything that you want to share, or you can or just share those in the comment section, or you can send them privately to info@trustimplants.com. And happy to take a look at those and see if there's, even if you're working with another doctor, happy to kind of help in the process if that's what if that would help. So anyways, sorry for getting on late today. It's kind of as we navigate through this live streaming process, we'll get better at it. But being that it's kind of one of our first ones, we're still learning. So anyways, I'm Dr. Willardsen, and visit us at trustimplants.com, or give us a call at 855-494-6752. Be sure and tune in next week on Wednesday. We'll be on time next week, and we'll have more good content for you then. I'm Dr. Willardsen here with Memo Hea. Thanks for being with us today.